Assalamu alaikum everyone. I hope all of you are doing well. In this video I am going to talk about pleural effusion. But before discussing the pleural effusion, I am going to talk about pleural space. Here you can see this is the lung. The lung is surrounded by a double membrane. One is the inner layer, which is the visceral pleura. The other is outer layer, which is the parietal pleura. In between these two membranes there is a potential space. Here you can see this potential space is called the pleural cavity or the pleural space. So whenever the fluid is accumulated in this pleural cavity, this condition is called a pleural effusion. So now how the pleural effusion is developed? There are three mechanisms by which the pleural effusion can be developed. One, there is increased drainage of fluid into the pleural space. Drainage of fluid is increased into the pleural space. The second, there is increased production of fluid by cells in the pleural space. This is the another mechanism by which the pleural effusion is developed. The third mechanism, there is decreased drainage of fluid from the pleural space. Normally there is 10 to 20 ml of fluid in the pleural cavity, but this continuously drained. When this drainage is impaired, it will result into pleural effusion. So now what are the types of pleural effusion? Before discussing the types of pleural effusion, I am going to differentiate between the transudative effusion and the exudative effusion. The criteria which is used to differentiate between the transudative fluid and the exudative fluid. This criteria is called the Light's criteria. This criteria said that a fluid is said to be exudative when the pleural effusion protein ratio to serum protein ratio is greater than 0.5. The second point in the Light's criteria, a fluid is said to be exudative. Ratio of the LDH of pleural fluid to that of LDH of the serum is greater than 0.6. And the third point in the Light criteria is saying that when the LDH in the pleural fluid is 2/3 of the upper limit of serum LDH, this will said to be exudative fluid. If one of the point in the Light's criteria is made by the fluid, it will said to be exudative fluid. There are two types of the pleural effusion. One is the transudative effusion and the other is exudative effusion. So I have already differentiated between these two types of effusion. So the transudative effusion is developed in congestive heart failure and hypoalbuminemia. And the hypoalbuminemia may be developed in nephrotic syndrome. It may be developed in liver failure. And the second type of the pleural effusion is the exudative effusion. The exudative effusion is mostly developed in pneumonia, carcinoma, malignancy, pulmonary embolism, viral disease. So now what are the causes of the pleural effusion? So these are the causes of the pleural effusion: congestive heart failure, hypoalbuminemia, pneumonia, malignancy, pulmonary embolism, viral diseases, and collagen vascular disorder. Now what are the clinical features that a patient of pleural effusion will present? There are some symptoms and signs by which the patient is present to the OPD. One, there may be dyspnea, and there may be orthopnea, and there may be paroxysmal nocturnal dyspnea. What are the signs in a patient of pleural effusion? There are dullness. When we percuss the chest of the patient, there will be dullness, and the breathing sound will be decreases, and the vocal primitus on the chest of the patient will also be decreases. So now how to diagnose the pleural effusion? Always start from the history, then proceed by the examination, and then by investigation. So in the history, the patient may tell to you about dyspnea, about orthopnea, and paroxysmal nocturnal dyspnea. While on examination, you may find dullness, and you may find decreased breathing sound and auscultation, and you may find decreased vocal primitive. So the other is investigation. There are mainly three investigations done in the pleural effusion. One is the chest X-ray, which is the initial investigation. The second is the CT scan, which is more reliable than chest X-ray, and the third is the thoracentesis or thoracocentesis. This is also called a pleural tape, in which the fluid is aspirate, in the fluid is then analyzed and make the diagnosis. So now how to treat the pleural effusion? The treatment of pleural effusion depend upon the type of pleural effusion. If there is a transudative effusion, diuretics and sodium restriction is the treatment. And if the pleural effusion is more, then thoracentesis or pleural tape is also done. This is therapeutic thoracocentesis, in which the fluid from the chest cavity is drained through a tube, which will relieve the symptoms of the patient like dyspnea or apnea. The other is the exudative effusion. Exudative effusion is further divided into uncomplicated and complicated. Uncomplicated is that type of effusion which there is no empyema. So the treatment of uncomplicated exudative effusion is antibiotics only, while the treatment of complicated exudative effusion is chest tube drainage